The Illinois Department of Public Health continues to add new zip codes to the list of, get this, high-risk areas for lead poisoning. Right now, there are zip codes, and just take a look at this, in all 15 counties we cover where blood testing for children is required. According to IDPH, the state is moving towards universal testing in 2026. Testing from January through August this year shows a 56% increase in the number of elevated lead levels. Officials say 42,000 children have tested positive for elevated levels since 2010, but since testing did not cover every child, they say the number much likely higher. This week is Lead Poisoning Prevention Week. We are so happy to have Shauna Ryan back in the studio with us for the safety alert. Thank you for taking the time to be here.
Thank you for inviting us.
Yes, and so whenever you hear this information, I mean, what goes through your head?
Well, it's good that we are seeing more kids tested because that's more kids getting the help they need. So what we're actually hoping is once we hit that hurdle next year and all the kids are tested, we'll start seeing those numbers go back down.
And talking about lead poisoning, I know some parents maybe or grandparents might be hearing this and they're maybe just a little alarmed. What should people know about this?
Well, we want people to realize that most often lead poisoning affects children under the age of 6 because in most cases it's injected. Now you can get it through blood contact, but most time it's injected. So we want to make sure those kids are getting tested because high levels of lead can impact their brain, their kidneys, their stomach, and we generally don't see it until we start seeing a developmental delay or a behavioral or a learning problem. So, you know, it's important for families to know if you live in a home or in an environment where there's a high level of lead, get your kid tested, make sure they're getting the treatment they need.
So lead can be found in so many different things.
Yeah.
What are we talking about here?
Yeah, we're talking first off toys. That comes to mind first and foremost. If you're like a lot of us that hold over those old toys from a kid, you know, from being a kid, put those away. More likely they've got lead. Also, we're talking about just paint in the home. If you live in a home that was built prior to about 1978, you might want to get your home tested. We're also looking at lead pipes, and there could be lead in your soil. So there's a lot of different ways that lead could get into your home and into your child's environment.
Now, who is the most at risk?
Children under the age of 6 are most at risk because they tend to put things in their mouth a little more often because what we're concerned about is making sure that if you have items in your home that you're washing their hands often, especially before they eat, making sure that you're washing any toys that they have, and as always, follow your doctor's recommendations.
So let's talk about testing now. Somebody's like, well, I do live in a house that was, before 1978, or maybe I'm curious if it's in my soil. How does the testing work?
Well, you want to contact your local health department. They will direct you to where you need to go. Southern 7 does not test for lead in the home. We do test it in children. So oftentimes the Environmental Protection Agency can help you determine if there is lead in your home. If there is, take the necessary steps to remove that lead. Follow those recommendations completely and thoroughly so you can get that out of your home and out of your child's environment.
And for the test for the humans, this is a blood test. Can you tell us more about that?
Yes, it is a blood test. It's also that for the child as well. So yeah, it's just a simple blood test to determine it. Oftentimes your local health department can do that. We do it at Southern 7, and your child's pediatrician might be able to do that. Once you are contacted and your child is at a higher risk, you'll be referred for treatment and what you need to do to get that out of your home.
And whenever you, just bringing this back to the top of the interview real quick, whenever you hear that so many different counties in Southern Illinois are being impacted by this, are you surprised at all?
Not really. A lot of the homes in our region are older homes. That kind of stands to reason. But again, what we're talking about too, because the state of Illinois did put more stringent levels of testing on that, we are seeing more kids getting tested, which is a good thing. Yeah. But it's also kind of frightening to know that it's around us as often as we, or more often than maybe we thought it was. But on the other side of that, starting next summer, it's going to be across the board. Every child under the age of 6 is going to get tested. You're going to start seeing those numbers drop, and that's a good thing.
Well, we appreciate you sharing the good thing here with us on Heartland Afternoon, Shauna.